Hi, I'm doing my admin med video. I'm going to show you my room and my workspace and my badge. I now am going to start by making sure that my workspace is, my door is shut and my workspace is as quiet as possible. Limit noise. I'm going to have limited conversations with my colleagues. I'm going to have no interruption policy, and that's about it. And now I'm going to check my order form compared to my MAR. I'm going to make sure I have the right patient, Jaguar J. Jones, right medication, regular insulin. I am going to make sure I have the right dose, 10 units, right route, subcutaneous, right time, 30 minutes before meals, right indication, which is to lower blood glucose, and right documentation, which is to have legal prescriptions available. And I now have all legal prescriptions, and all of this matched perfectly. So I'm going to place my order form over here to get it out the way, and I'm now going to perform hand hygiene, and I'm going to start with my first 7 rights of administration. I'm going to make sure I have the right patient, Jaguar J. Jones. I'm going to make sure I have the right medication. I have regular insulin here. I'm going to check that expiration date, which is 12/1/2025, so we're good. I'm going to, now that we have the right medication, I'm going to check for the right route, and we are going to be doing subcutaneous today. So I have a insulin safety syringe here, and I'm going to be using this today, and I am going to need the right dose. So I'm going to be needing 10 units. So I will rub an alcohol wipe on this, and then I'm going to make sure that I get 10 units of air, and I'm going to put this in here, and I'm going to inject the air in, and then I'm going to pull out, making sure that I get exactly 10 units and making sure that I have no air bubbles. I'm then going to show you that I have exactly 10 units. Perfect. Exactly 10 units, and I'm going to put the safety up on this. I now am going to make sure that I checked the right route, which is subcutaneous. The right time is 30 minutes before meals. Right indication is to lower blood glucose, and the right documentation is to have all legal prescriptions. I am now going to start my second check. I'm going to make sure that I have Jaguar J. Jones, right patient. I have the right medication, which is regular insulin. I am going to put this up to here and make sure regular insulin. I'm going to make sure I have the right amount. It is 10 units. For certain medications, you have to double check with another nurse, and then subcutaneous, this is a good needle for subcutaneous. 30 minutes before meals is what we need for time. Right indication is to lower blood glucose, and for documentation, we need all the legal prescriptions. So here I have my my tag filled out, and so I have Jaguar Jones, regular insulin, and 10 units. And so Jaguar Jones, regular insulin, and 10 units. Compared to my MAR, this is great. I'm going to put this onto my syringe, and I'm going to make sure that it is good on there. And so now I'm almost ready to go into my patient's room. I'm going to grab my MAR. I'm going to grab my syringe, and I'm going to grab my vial, and I will head to the patient's room. So now that I'm in the patient's room, I am going to, hi, I'm Jaguar. Hi, Jaguar J. Jones. I am Reagan. I'm here to give you 10 units of insulin today. I'm going to make sure that I do have Jaguar J. Jones. So we have Jaguar J. Jones here, Jaguar J. Jones. Date of birth is 8/25/1963. 8/25/1963. The MR number is 4176352. 4176352. That looks great, Jaguar Jones. I'm going to lower that bed rail and put that bed up to a comfortable working height for me. And I'm going to now perform the 7 rights again for you. So, before I perform the 7 rights, I'm going to explain the procedure to you. Today, I'm going to be giving you regular insulin. I'm going to be making sure that I give you 10 units of that, and I'm going to be giving it to you subcutaneously. So I'm going to use your abdomen. I'm going to make sure that I stay 2 inches away from your umbilicus. I'm going to use the borders of your intercostals, your inferior superior iliac spine, and your pubis. I'm going to make sure that so now that I've explained the procedure to you, I'm going to start the 7 rights. I'm going to make sure that I have the right patient, Jaguar J. Jones. Jaguar J. Jones here on his thing. I'm going to make sure that you have no allergies. So I'm here. I know you have penicillin allergy. Is there any other allergies we need to know about today? Okay, great. So now 7 rights. Right patient, Jaguar J. Jones, Jaguar J. Jones. Right medication, regular insulin, regular insulin. I have regular insulin here, and I have regular insulin in my vial. And 10 units right here, and I have 10 units exactly in here. Sub-Q, I've already explained to you what subcutaneous is. That's our injection, that's the route. 30 minutes before meal, you are about to eat in 30 minutes, so this is great. Your indication, we are giving this to you today to lower your blood glucose. We are the right documentation, so you have all legal prescriptions here today. So now that I've done that, I am going to put this to the side, and we are going to do your injection. So what I have today is I'm going to take a second. I have your bed rails down and your bed up to a working height, and I'm going to perform hand hygiene, and then I'm going to put my gloves on. And my goggles. And I am going to get a clean alcohol wipe, and I'm going to start from the inside and go to the outside, and I'm going to leave this pad right here on the side. I am going to now get my syringe, and I'm going to pull it down for the safety. And we're doing sub-Q today, so I'm going to pinch 2 to 3 inches, and I'm going to go 90 degrees in, and I'm going to slowly inject. I'm going to pull out and place pressure on the skin. And make sure I put this in my sharps container. I am now going to hold slight pressure. Before I injected, I should have made sure that I checked to make sure there were no rash or bruises around the skin. And now I'm going to throw this away, and I'm going to now make sure that my patient is good and comfortable, and I'm going to make sure that the bed rail is raised back up and that I've positioned the position comfortably, and I have lowered the bed. I'm going to make sure that now I can take my gloves off and make sure the patient doesn't need anything. I'm going to come back in 15 minutes to assess. I am going to make sure that I throw everything away, and I'm going back to document, and I'm going to use my MAR to document, and I'm going to write everything down in my MAR, and I'm going to make sure the patient didn't have any adverse reactions or anything that they need documented. I'm going to take my goggles off. I think I'm done.